All right, we are joined now by a doctor on the front lines in the fight to contain this global pandemic, Remote Health Solutions Chief Medical Officer, Dr. Jonanthan Baugh. Doctor, tell us where you are and how things are going.
Yeah, thanks, Bob. Thanks, Grant. So my company, Remote Health Solutions, is located in Richmond, Virginia. However, I'm a practicing ER physician, and I live and practice in southern Utah. So when I answer that question, I get to look at sort of two aspects. I get to look at where I am locally practicing emergency medicine, and I get to look at where we are on a national scale, where we are practicing telemedicine. I'd say on a local scale, we are sort of at the front of the wave, meaning that we haven't hit the peak. We're not New York, we're not California, we're not Washington, and where they are climbing steadily. We are starting to see patients. We're starting to see increased number of patients, and we're starting to see what the future impact will be over the next several weeks and couple of months. As far as a national scale with our telemedicine and our ability to be able to see and evaluate and monitor patients at home, we see this kind of the same thing. This national scale is still behind those big epicenters, and we're not at its peak yet. We're going to see a lot more cases, and we need a great plan in place.
Dr. Baugh, you are turning to technology to do your best for your patients. Can you walk us through what that is like for you and maybe some of the challenges of doing it from a distance?
Yeah, sure. I mean, that's a great question. Classically, we talk about telemedicine. Classically, that was originally just a phone call, a telephonic communication. And then came along sort of the FaceTime, the video correspondence. Well, one of the things that's unique about our technology is the ability to not only have a video conversation, but also to gather data. And so what we do with our patients who are under investigation or who are patients we're monitoring at home is a direct extension of what we've been doing before the COVID-19, and that was remote patient monitoring and chronic care management, where we send home a small tablet with some associated peripherals. They take that tablet and those peripherals home with them. We send it to them in their home, and then every day they're able to gather their vital signs. They check their blood pressure, they check their temperature, they check their weight, all of those things, maybe glucose if they're a diabetic. And then that information gets stored on the device, it gets forwarded to our cloud, and then using some simple AI, artificial intelligence, we get flagged for changes that are outstanding in those patients' vital signs. And then we have nurses and physicians that are able to reach out to those patients. That is how we've been able to extend into this COVID-19 management of patients. Maybe they are mildly symptomatic, maybe they are even asymptomatic positive patients. We're able to send them a device, keep them in their home, keep them isolated, keep them quarantined, and then watch them, not only with gathering the data, but then able to have a live telemedicine visit with them as well. So we get the merger of two great ways to be able to see and evaluate that patient. And that is really keeping people out of their doctor's office, is keeping people out of the ER. And we're trying to use that one more tool to flatten the curve and to be able to improve outcomes.
But I assume then you cannot necessarily diagnose someone as having coronavirus, but you can monitor them and therefore not overflow in the local emergency room.
No, yeah, I mean, that's a great question. So we talk about the characteristics and the symptoms of COVID-19. And those, but unfortunately, those are very common. They're cough, shortness of breath, and fever. And then now maybe some additional associated symptoms, maybe GI upset or diarrhea, nausea, vomiting, body aches. But unfortunately, those are common. So we have to look at the whole picture. We have to look at, do they have those common symptoms? Do they have risk of exposure? Have they been around somebody else that is a possibly positive COVID-19 carrier? But the real defining characteristic is to be able to get that positive swab, that positive laboratory test that says, yes, you do have SARS-CoV-2 or COVID-19 as a lab test.
Okay. Okay, well, Dr. Baugh, we appreciate your help and offering your expertise, and it's amazing how technology really is aiding and helping you all at this time to really help to avoid a doctor shortage too, because doctors need to stay strong and tough during this.
That's right. That's right. And then when it gets to be a certain point, they can go into the emergency room if it reaches that. Thank you so much, Doctor. Now time to check in with our man with his ear to the ground in Washington, D.C., John Gizzi. John.